Welcome everyone to the Center for Successful Aging speaker series. For those of you who don't know me, my name is Yveris Martinez, and I'm the Archstone Foundation Endowed Chair in Gerontology and Director of the Center. And we try to put together this speaker sessions about once a month in order to share the research and programs on aging going on in Long Beach and beyond. And today it's my pleasure to introduce Dr. Judy Jou, who is Associate Professor at the Department of Health Sciences here at California State University. Her areas of interest include health policy, health services research, and systems level approach to improving healthcare across the lifespan. Prior to joining CSULB, she worked as a policy analyst at UCLA, where she examined the extent of impact of social policies such as paid family leave, Social Security, and pension systems and labor laws on health and well-being in countries around the world. Currently, her research addresses family caregiving and its impact on the physical, mental, and financial well-being of older adults, as well as policies and practices to better support caregivers. And in particular, today she'll be talking to us about her work on the experiences of student caregivers here at Cal State Long Beach. And with that, I'll give Judy the floor. Thank you for joining us.
Thank you for the introduction, Yveris. I'm very happy to be here today. Thank you to everyone for being here today and spending your rainy Tuesday afternoon here with us. So I'm excited to share some of the work that our team has been doing around the topic of students here at CSULB who are family caregivers today. So let's go ahead and get started. So before I begin, I do want to take a minute to acknowledge the many collaborators that have helped make this work possible. You can see all of them listed on this slide. Center for Successful Aging, obviously, College of Health and Human Services, and then ours and CHE here at CSULB have been wonderful in linking me with a lot of amazing student research assistants over the years, and you can see all of them listed on the right-hand side on this slide. You can see many of them have graduated and moved on to bigger and better things, but this work wouldn't have been possible without their contribution. So I wanted to give a shout out to them. Okay, so the structure of my talk today is fairly straightforward. I'm going to start out with a little bit of introduction and background on family caregiving in general, and then I'll spend the majority of our time together sharing some of the main findings from our research. We're going to cover the themes of who are our student caregivers, what types of challenges do they face, and what are some opportunities for supporting student caregivers here at Long Beach. I'll wrap up with a brief summary and discussion of limitations, and then I'd like to start a conversation with everyone here about ideas for next steps. I believe we'll wrap up with a Q&A, but if anyone does have any questions or comments as I'm talking, feel free to bring them up at any time as well. Okay, so to start us off, I'd actually like to ask folks here to take a quick poll. So I'm a professor at heart, so I'm all about audience engagement. And so if you're interested and able, feel free to either scan the QR code you see on this slide or go to menti.com and enter the code that you see here. So I'll give folks a minute to do that. Again, if you're interested and you're able to do so. Once you've opened the page, don't start yet. I'll switch over to the live poll so that we can all answer the questions together. So it's a very short poll, 3 questions. No one's going to be graded, so don't worry. So I'll give folks a minute to head over, and then I'll switch screens actually so we can start taking the poll. And if folks want to give a thumbs up, once you're over on menti.com, we can make sure we're able to successfully get there. Oh, okay, folks are starting to take the poll already. That's good. All right, so if you're over here, feel free to start answering the question. A good number of responses so far. Okay, unanimous for yes. Right. If anyone wants to continue responding, feel free. But it looks like a good proportion of those of us here who are perhaps interested in this topic have either been a family caregiver or knows of somebody who's a family caregiver. And so thank you all for sharing. I really appreciate it. Appreciate you participating. And this is actually probably not surprising, right? Caregiving is such a common experience. And that's one of the things I wanted to highlight in my talk today is that caregiving is common for everybody. And so there's no reason to think that students here at CSULB are not family caregivers as well. And we'll talk a little bit more about that in a minute. This is a 3-question poll, so bear with me. There is a next question. This is an open-ended question. So what words come to mind when you think of family caregiving? And this can be anything. It could be short words, phrases, completely open-ended. And feel free to share anything that comes to mind when you think of family caregiving in general or family caregiving as you think it might pertain to students. Okay, we've got patience, unpaid, stressful, giving of time, responsibility, juggling, absolutely, challenging, exhaustion, okay, persistent, okay, gratitude and burden, responsibility, guilt, okay, absolutely, balancing act, transportation, okay, okay, a lot of responses around guilt and responsibility, anticipatory grief, exhaustion, stressful. Okay, well, thank you again, all of you, for sharing. If you're continuing to enter words, feel free to do so. But these are all very common themes when it comes to caregiving, right? So there's definitely a lot of responsibility involved. For a lot of people, it can be very stressful. And you're right that a lot of people do feel guilt. And a big part of that is because folks often feel like they have to balance between, their roles as a caregiver and everything else they have going on. So for a lot of us, that's work. For students, a lot of the times that's school, and a lot of them work as well. So it really is a balancing act. There really is a lot of juggling. And that's not to mention the kind of emotional impact of caregiving, right? A lot of the times they're caring for family members who are ill, who may not be expected to recover. And that comes with a lot of mental and emotional burden. So absolutely, thank you all for sharing. We'll explore some of these themes moving forward as well. All right, one last question. So this kind of leads into our talk for today. So for those of you who may or may not know, what percent of family caregivers do you think in the US are college students? So out of all the family caregivers in the US, how many percent do you think are students? Okay, we've got 1%, 5%, 10%, 25%. Some varied responses here. We're all thinking of at least 5%. It looks like we're thinking maybe 10, maybe 25. Okay, so I think the majority of our audience is correct. So latest estimates put the percentage of family caregivers who are college students at around 10%. So it kind of varies from year to year, but it is around 10%. That's still not an insubstantial proportion of our caregivers. If you think about, caregiving starting, from the very beginning of adulthood at age 18 all the way through the end of life, the fact that 10% are college students is a pretty substantial amount. All right, so thank you all so much for participating. I really appreciate it. And let me go ahead and switch back then to the main talk. So give me a moment here. All right, so okay, technical difficulties. Let's see. Okay. All right. So thank you all again for participating. I really appreciate everyone sharing your thoughts and responses. So as we saw in our poll, right, and as many of you probably know, family caregiving is a pretty common experience. Latest figures from the AARP show that around 22.5% of US adults are family caregivers at any given time, and that's equal to around 59 million caregivers throughout the US. And you can see that there's actually a pretty rapid increase of the prevalence of caregiving from 2020, which is just 5 years ago, until now. There's been an increase of more than 10 million caregivers in the US. So the prevalence of caregiving overall is fairly high, and it is expected to continue rising as the US kind of becomes an aging society. And when it comes to caregiver well-being, there has been quite a bit of research done in this area, and the findings kind of reflect what our word cloud showed, right? So it shows that it can be rewarding in a lot of ways, but caregiving can also have significant negative impact on caregivers' physical health, emotional, and financial well-being. A lot of caregiving related activities can be physically intensive, and a lot of caregivers, because they have to balance so many things, they don't have very much time for self care. And then in the US, unfortunately, with our healthcare system, medical expenses can add up quickly. So a lot of caregivers also pay out of pocket for medical services, and a lot of them have to cut back hours at work or maybe even quit their jobs in order to care for their family members. So the impact of caregiving on a caregiver can encompass a lot of different realms. Research shows that there are certain important demographic and socioeconomic differences in caregiver well-being. So again, from the AARP, which is kind of a leader in this area, they found that physical and emotional strain are tend to be highest for caregivers who are younger, those who are female, those who identify as Hispanic or Latino, those who are lower income, and folks who are LGBTQ+. And a lot of these same populations also experience greater financial setbacks. And so, what this means is that these groups can experience greater health disparities, especially because a lot of them are already underserved and face a lot of structural and systemic disadvantage. So when it comes to students, as mentioned in our poll, around 9% is the latest estimate of the percent of family caregivers nationwide who are college students. This is equivalent to around 5.3 million caregivers who are full or part-time students at a college or university. So again, not a small number of people. Student caregivers, demographically speaking, do tend to differ from the overall caregiver population in some important ways. They tend to be younger, which is probably not surprising. So almost two-thirds are between the ages of 18 to 34. The majority of student caregivers actually identify as a race or ethnicity that's not non-Hispanic white. And a large proportion are balancing, as we mentioned earlier, caregiving with schoolwork and also paid employment. So 86% of our student caregivers are employed. When we look at the prevalence of caregiving among the student population, we also see some of these differences. So caregiving is more common among students who are Hispanic and Latino, and also non-Hispanic Black compared to non-Hispanic white students. And one of the reasons why it is important to focus on the student caregiver population is that they can face challenges that are unique to their circumstances and their student status, right? And so again, AARP in 2020, they did conduct a national survey of student caregivers, and they found that the vast majority, 90%, have experienced impact to their academic success, and almost as many, 87%, have experienced financial strain related to caregiving. And student caregivers can often be what we call an invisible population because a lot of colleges and universities may not be aware that there's a substantial portion of their student body who are caregiving. And so they don't design their policies or services with this particular population in mind. And so, again, from the AARP, you can see that only 5% of their sample knew of any institutional resources or policies tailored to students or family caregivers. So what we can see from the existing research is that student caregivers are a population that can really benefit from greater awareness and support. And so that leads us to the study that I'll be presenting today, and because this is one of the motivating factors behind our research. What we're really trying to do is to understand and support student caregivers so that as individuals and as communities, we can all kind of work together to help reduce academic barriers, promote well-being, and reduce educational disparities for this population. So the work that I'll be presenting today represents an ongoing series of smaller research studies that take slightly different approaches to better understanding the student caregiver experience here at CSU Long Beach. So as you can see, our first pilot project over to the left-hand side of this slide took place in 2021 and 2022. We fielded a survey and we conducted some focus group interviews amongst student caregivers here at Long Beach. Last year, in collaboration with the Center for Equitable Higher Education, we undertook a project that was mainly looking at basic needs and social support among CSULB undergrads, but we did include a small element looking at family caregivers. And then this year, and hopefully continuing beyond this year, we're also working on several projects. One of them involves a brief longitudinal follow-up of caregiver and non-caregiver students over the course of the academic year. So the results that I'm presenting today are drawn kind of across these projects. So the first question we wanted to explore, we really just wanted to better understand who our student caregivers are. What we found was that around 11% to 33% of students here at Long Beach are family caregivers. This figure can vary depending on student status. So caregiving tends to be more common among graduate students compared to undergrads. A lot of the times our graduate students are older, they're maybe caring for an older generation plus their own children. And so caregiving can be more common for that group. These figures are mostly derived from convenience samples so far, so they may or may not be reflective of the entire student body. And this is one of the limitations of our work that I'll talk about a little bit later, but an opportunity for more work in the future as well. But regardless of the specific number, we can see that there's a relatively substantial proportion of the student body here at CSU Long Beach who are caregivers. We also found that students are mostly caring for a grandparent, so 38% for a grandparent, 37% for a parent. There's some who are caring for a sibling as well. And the most common conditions that the care recipients have are cognitive impairment, including dementia and Alzheimer's disease, general age-related conditions, and also developmental disabilities. So the developmental disabilities mostly in the siblings. Demographically speaking, there are certain ways in which student caregivers in our sample differed from the overall student population. And there's just two that I wanted to highlight here. So these figures represent the gender composition and the racial and ethnic composition of our student caregiver sample. So you can see that within our sample, a pretty large proportion, so around 72% are female. And compared to the overall student body here at CSULB, only 58% are female. So female students are disproportionately represented among our caregivers. Student caregivers are largely Hispanic or Latino or non-Hispanic AAPI. And again, if you compare to the overall student body composition, what we found was that non-Hispanic AAPI and non-Hispanic Black students tend to be overrepresented among our student caregiver population. So students in these groups are more likely to be family caregivers. And then a third attribute we wanted to look at was the amount of time that students were spending on their caregiving responsibilities. And I'll be referring to this as caregiving intensity. But as you can see, this graph on the right-hand side breaks down kind of the amount of time that students are spending each week on caregiving related tasks. So we have around just over a third spending 8 hours or fewer per week. We have just under a third spending around 9 to 19 hours, and then the rest spending 20 hours or more. And one thing to highlight is that we have actually around 10% of our sample who are spending 40 hours or more per week on caregiving, and that's the equivalent of a full-time job, right? So some of our students are giving a lot of their time and their effort to their caregiving tasks. One thing that kind of stood out in our findings in this area was that if we break down the caregiving intensity by gender, and you look at the bar to the very right-hand side, which represents those spending 40 hours or more per week on caregiving, there's a very high proportion of that group who are female. So the pink section in the middle of the bars represent our female students. The dark maroon at the bottom are male respondents, and then the light lavender at the top are non-binary students. And so again, if you look at the highest level of care intensity, that proportion of female to other genders is very high. So what that means is that many of our female students are carrying some of the highest burden of care. So beyond our student caregiver kind of demographics, we also wanted to explore the types of challenges that our student caregivers may face. And so one of the striking things we found in our basic needs study last year was that students who are family caregivers are twice as likely to experience food insecurity when we compare them to those who are not caregivers. And that's after we accounted for factors like age, race and ethnicity, gender, and then financial aid status, which we used as a proxy for income level. So even after controlling for all of these factors, we found that caregiving in and of itself predicts twice the likelihood of experiencing food insecurity. Within our caregiver sample, the level of perceived burden is relatively high. And so we measured perceived burden using this validated instrument, which contains a series of questions that capture different dimensions of well-being, including physical, emotional well-being, and then also social and financial impact of well-being. And so this instrument gave us a composite score ranging from 0 to 30, as you can see in this graph along the bottom x-axis. And 0 represents no burden, and 30 represents the highest level of burden. So as you can see, we have kind of a normal distribution, which means that around 1/3 of our student caregivers report low levels of burden. That's the section to the left-hand side of the first dotted line. We have that pretty substantial middle section between the two dotted lines. Those are, again, 1/3 of our sample experiencing moderate burden. And then to the right-hand side of the second dotted line, those are the students who are experiencing severe to very severe burden. And again, that's around 1/3 of our respondents. So you can see that overall, the level of perceived burden among our student caregiver population is relatively high. Okay, so we also asked students about the perceived impact of caregiving on their academic experience, as you could potentially barely see in the graph on this slide. There were a lot of results here, but there are 3 that I wanted to highlight here today. And so the first is that around 2/3 of our samples, around 66% of our respondents, reported feeling torn between the demands of school and caregiving, right? So that goes back to what all of you shared earlier about caregiving really being a balancing act and kind of juggling a lot of different responsibilities. And this can be really important because feeling torn is an indicator of role strain. So feeling, divided between different roles, maybe as a caregiver versus being a student. And this has been shown to lead to poorer mental health outcomes and higher levels of stress. So feeling torn is kind of an indicator of poor mental health later on. We also have around 2 in 5 or 41% of our sample report some kind of delayed academic progress. So that's either taking longer to finish certain coursework or delaying graduation due to their care responsibilities. So as universities, I know that time to completion, timely graduation can be important outcomes for our students. And so when we think about those things, caregiving can actually be a barrier to academic progress. And then the last result I wanted to highlight is that only around 1 in 5 of our respondents, or 21%, reported feeling that professors are understanding if they miss deadlines due to their caregiving responsibilities. So there is a sense among our student caregivers that students may not receive support for their caregiving responsibilities in an academic setting. So these results are self-reported by students, and they are only from the perspectives of students. So I do want to acknowledge that professors may actually be doing a lot to support students, but even the perception of the lack of support can prevent students from seeking help, right? So this can still be informative. And then, as I'll talk about later, it's an opportunity for additional research as well to understand more from faculty and staff perspectives. Okay, so we also found some significant differences in students' experiences among socio-demographic lines. There were several that we found, but there are, again, 2 that I will highlight here. The first is age. So we consistently found across our different studies that age is a major factor in student experiences. Older students in particular, so those who are 25 and over, they tend to spend more time on caregiving. So they have greater levels of caregiving intensity, and they also experience greater impact to their well-being as a result of their caregiving. So the graph on this slide shows the level of perceived burden by age category, right? So if you look at maybe the bucket of bars to the very right-hand side, which represents the percentage of our respondents who report severe to very severe burden, you can see that students who are 25 and over, that's the kind of purple bar in the middle, over 40%, 44% of our older students are experiencing severe burden compared to just 20% of our younger students. That's the dark purple bar to the left. So you can see that the level of burden for our older students is quite high compared to our younger students. This is also reflected in our qualitative data, and you can see some quotes from the students, again, on this slide that highlight some of the challenges that our older students experience. So we have a 42-year-old student at the top saying that she is caring for both her father and also a son. And so there's really no time for self-care. We have a 29-year-old student in the middle sharing that she wished that her peers understood the struggle she's going through, trying to balance caring for her grandma and also keeping up with her schoolwork. And then we have a 51-year-old student at the bottom saying that he's tried his best to balance, but still feels like he's drowning sometimes. He shared that he worked very hard to get into CSULB and wants to succeed. So you can see that our older students may be a group that is in need of greater support. Another significant difference that we found was in students' perceptions of professor support by race and ethnicity. So previously, remember I shared that around 1 in 5 of our student respondents agreed that professors were supportive. This differs quite a bit by race and ethnicity. So the graph on this slide shows the degree to which students agree with the statement. My professors have been understanding when I have to miss class or turn in a late assignment due to caregiving responsibilities. And again, if we focus on the group who agree with the statement, so the students who do feel that their professors are supportive, that's the bucket of bars to the right-hand side, you can see some very large differences by racial and ethnic group, right? So among our Hispanic and Latino students, only 12.5% feel that their professors have been supportive. And if you compare that to our non-Hispanic white students who are represented by the dark purple bars, 55% of our non-Hispanic white students agree that their professors were supportive. And again, you can see that kind of play out in our qualitative data. In our quotes to the right, we have a Hispanic and Latina student saying that she feels embarrassed to ask for help from professors. She doesn't feel that they would be willing to accommodate. We have an AAPI respondent saying that they have difficulties providing evidence for an excused absence. And then just kind of in contrast, we had a non-Hispanic white respondent sharing that she felt that the university has demonstrated commitment to supporting her as a caregiver. And so there's really this wide range of experiences that we found by race and ethnicity, which then kind of raises the question of how can we do better for everybody, right? How can we implement systems or implement policies that can help ensure more equitable access to accommodation and support across all of these different demographic lines? Okay, so then our final research question focused on support. We wanted to look at the types of support that were currently being used and then also student recommendations for additional forms of support. So overall, we found that use of supportive resources was relatively low. So fewer than 1 in 4, around 23% of our respondents have used any type of supportive resource related to their caregiving. 18% have received supportive services at school, around 5% have used community-based resources, and then around 8% have received financial support. So again, the overall use of supportive resources is relatively low, and that led us to try and examine, what types of resources and supportive services do our students need more of. So one type of support that we found students recommending was information. We found that only around 18% of student caregivers agreed with the statement that they know where to seek on-campus support or accommodation due to their caregiving responsibilities if they need it. So that means that 82% of our student caregivers don't know where to turn for support. And again, you can see that kind of play out in the qualitative quotes we have here, where students are sharing that they had no idea that CSULB offered any support and that greater awareness would be helpful to them. And information can actually be really important and have a tangible impact on outcomes because information can help relieve stress. As we can see in the graph on this slide, we're looking at the level of perceived burden, again, kind of an overall indicator of student well-being, broken down by how much informational support students have. So if you look at, again, the very right-hand side bucket, which represents the students who do know where to turn for support, you can see that a majority of students who know where to turn to for support actually experience very low levels of burden, right? So 61% of students who know where to turn for support are experiencing none to mild burden. Only around 11% are experiencing severe burden. And then if you contrast that to the bucket to the very left-hand side, which represents students who don't know where to turn for support, you can see the kind of opposite pattern, which is that students who don't know where to turn for support tend to experience higher levels of burden. So information really matters, and this is one potentially, easy way that we can help our student caregivers is to raise more awareness about student caregiver needs and resources, both among, faculty, staff, the institution, and among our student caregivers. Another type of support that our students reported needing is academic accommodation. So this was very common. We found that only around 18%, again, have used any kind of school-based accommodation. But we also asked students if they would use this type of resource if it were available to them. And 69% said that they would use some kind of academic accommodation if it were available to them. So again, we have a selection of quotes on this slide. For the sake of time, maybe we won't go into them in detail, but you can see some suggestions from students for specific types of academic accommodations or resources that would be helpful to them, right? So we have a student to the left in yellow saying that maybe earlier course selection or priority course registration can help prevent situations where they aren't able to progress to higher level coursework because of any kind of roadblocks related to caregiving. In the green, we have a student talking about how remote classes, in this case, it was during the pandemic, were actually very helpful because they were able to stay home and take care of their or of his mom while still being able to attend class and complete schoolwork. We had a student in the kind of turquoise talking about perhaps if we had a system like BMAC, which is the Bob Murphy Access Center, which helps students with disabilities arrange academic accommodations, that would really lessen the load and the burden on the students themselves so that they don't have to go to every single professor and ask for accommodation and explain their situations, which can be helpful to them. And then finally, we had a student over to the right in blue suggesting that maybe a counselor or an academic advisor who is specifically trained to work with student caregivers could provide more tailored advice in terms of how to navigate academics for students who are caregivers. So this is a small selection of some of the suggestions that our students had for services and practices that could potentially be helpful to them academically. Another type of supportive resource that students mentioned needing was mental health resources, right? And so, again, given the stress and the kind of emotional impact and mental health impact that caregiving can have on our students, it's not surprising that a lot of them are seeking mental health resources. our students reported, or 10% of our students reported that they had joined a caregiver specific support group. And again, among the ones who hadn't joined a support group, around 58% would actually find it useful if it were available to them. Our students advocated for on-campus services and facilities to promote mental health, with the idea that some of these resources could help relieve caregiving-related stresses and provide them with some kind of reprieve from their caregiving situations. And so, again, directly from our students, you can see that specific mental health resources that might be helpful to them include informal support groups, greater access to CAPS, which is our counseling and psychological services, and then also just a general sense of community, a community of like-minded people who can provide them with a more robust support system. Also recommended by our students are material resources. So at the beginning, we talked about the financial impact that caregiving can have on folks who are spending a lot of their time, their effort, and maybe their money on medical services, medical equipment, and so on. And so what we found in our study was that nearly 2 in 5, so around 39%, of our student caregivers reported experiencing financial difficulty as a result of their caregiving. And separately, 39% also expressed being worried about the future because of their caregiving responsibilities. Specific challenges include limited eligibility for financial aid and benefits, and then also limited time for professional development activities and extracurricular activities. So again, you can see that reflected in the quotes at the bottom. We had a student speaking about not having time for an internship or volunteer work and feeling like they're falling behind of their classmates. We had one student suggesting that meal kits or ABT cards would be helpful. And this kind of ties back to our finding about student caregivers being at greater risk of food insecurity. And then we had students just feeling like they may not be able to financially complete their education because of lack of access to financial aid. So inability to continue paying for school could be a barrier to academic progress as well. Okay, and then finally, so we have been focusing a lot today on some of the negative aspects of caregiving and the negative impact of it. And obviously, our student caregivers do face many challenges, but also one of the things we found that I like to highlight is that many of the students show a lot of resilience and a lot of strength in taking on their caregiver roles. And so there's opportunity to support them by reinforcing some of the positive aspects of caregiving that our students may experience. So for example, we did find that over 80% of our respondents report having a good relationship with the person that they're caring for. 2/3 are able to still feel a lot of joy. And so when we think about supporting our student caregivers, it's not necessarily only about maybe mitigating the negative impacts of caregiving, although that is important. But we can also do a lot to potentially recognize and celebrate caregiving as an act of love and gratitude, and kind of recognizing the strengths of our student caregivers using a more kind of strengths-based approach. And so here again, you can see a small selection of quotes from our sample where students were very open in sharing how much they appreciated being able to spend time with their family and to grow close to some of their family members before they passed away. We have a student in the middle saying that he doesn't regret any of the time that he spent caring for his grandfather. He could have done more. And then the last quote on this slide is just a response to an open-ended question that we asked, if asking students whether there was anything else they wanted to share about their caregiving experience. And this student simply said he loves his mom, right? And so there's a lot of positive emotion and a lot of love and a lot of gratitude being expressed by our students. And that's something that can be highlighted and can be promoted more in order to kind of normalize students' experiences, reduce any kind of stigma or shame around caregiving, and really kind of celebrate our student caregivers. Okay, so just to wrap up with a quick summary, So what our research shows so far is that, again, family caregiving is a relatively common experience among students here at Cal State Long Beach. Up to 1 in 3 might be a caregiver at any given time. There are some also who are former caregivers. So it wasn't shown in today's presentation, but we also gathered data from students who had been a caregiver at some point during their time at CSULB, but were no longer doing so, oftentimes because their family member had passed away. And we found that the impact of caregiving on students extends beyond just the immediate care situation, right? So caregiving has lasting impact on student well-being even after they're no longer actively caring for a family member. Again, just to summarize, student caregivers tend to be demographically and socioeconomically different from the overall student population in some ways. And this really, again, highlights the need for more kind of equity-driven approaches to serving this population. And as we've seen today, students who are caregivers face a lot of different types of challenges. Balancing caregiving with work, with their academics, sometimes with work. They're facing food insecurity, financial difficulty, and oftentimes an uncertain future. And supportive resources tend to be either unavailable or maybe just not known about very well. And so I mentioned there's a lot of limitations to the work that I presented today, but I'd also like to view these limitations as a opportunity for future and better work on this topic. And there's, a lot of different ways to grow grow this research in terms of both scope and rigor. And maybe some of you here today are interested in taking this work forward as well. And so first, like I mentioned, the data here that I presented today are drawn from smaller convenience samples. And so one kind of obvious next step would be to recruit a larger and more representative sample of CSULB students, and maybe if possible to follow up with them over time so that we can gain a more comprehensive understanding of student caregivers as part of the overall student body. Also, the experiences, again, I've briefly addressed this before, but the experiences shared here today are only from the perspectives of the students. They're also just based on self-report, so survey and focus group interviews. And in order to really gain a fuller picture, a more comprehensive picture of the student caregiver situations and especially potential impact on academic outcomes, it would be helpful to maybe supplement with institutional data, administrative data, and then also maybe data collection efforts that focus on families, faculty, staff, as well as the broader just kind of campus community and also the Long Beach community. And then kind of turning to next steps, learning about experiences really is just the first step. And what's, I think, a useful next step for all of us to take would be to start thinking about ways to meaningfully support our student caregivers and identifying opportunities for action. And so that leads me to my kind of final slide, which I'd like to see as an invitation to start a conversation among those of us here, and maybe for you all to take into your circles and have some conversations with your networks as well. But in terms of next steps, it helps to do some brainstorming about what are some meaningful actions that we can take to move this work forward. So here are some ideas that I've listed just to start us off. But again, ideas from all of you and from your networks would be very welcome in terms of moving this work forward. So I kind of divided the potential next steps into research and practice and policy, but they are all really interrelated. In terms of research, as I mentioned, a more kind of comprehensive and robust data collection effort can help us better understand the scope and impact of caregiving among the full student body. So for example, we have institutional research and analytics. They all already do a lot of great work keeping track of different characteristics of our students. So maybe there's potential for partnering with them to do some data collection in this area. Another potential next step for research, and this is actually something that my team is working on this year, is to explore what other universities might be doing to support student caregivers, right? So there is some growing recognition of the student caregiver population at various institutions throughout the country. And there are some schools who have started creating resources or at least, informational websites aimed specifically at student caregivers. So learning more from other universities and learning more about how they are supporting student caregivers can help us at Cal State Long Beach design resources that kind of take into account best practices. And then one thing that I think is also important for us to keep in mind is the diversity of our student caregiver population, right? And so family caregiving is so inherently tied to our cultural values and our values around family, our perceptions around identity and family relationships or responsibilities to our family. And so in order to really design resources and services that are effective in supporting all of our student caregivers, we really want or should want to learn more about ways to tailor services so that they can be culturally appropriate. And again, this kind of leads to the open-ended question for everyone here of what more should we know about student caregivers and how they can be supported. In terms of practice and policy, there's really so many possibilities. You saw some of the recommendations from our students earlier, and obviously this is a wide open field, really, and there's a lot of opportunity to partner with folks on campus to do more work in this area. Again, these are just some initial suggestions based on our respondents' recommendations. So one important thing is to raise awareness, right? And so to really work with everyone on campus to kind of better recognize this population as a population that might need additional support, creating outreach efforts, workshops, trainings, events that can really highlight this particular segment of our student population. This can help improve students' informational support, which, as we saw, can reduce burden, maybe remove shame or stigma, and also create a sense of community with our student caregivers. Our student caregivers, again, recommended different types of academic accommodations that they might need. And so maybe revisiting some of our policies for academic accommodation, including course registration, financial aid, and so on, could be helpful as well. Another potential avenue for action is to leverage existing resources in order to promote student caregiver success. So student caregiver needs are really cross-cutting. And so there is opportunity to work with existing offices and services like academic advising. We have parent and family programs, CAPS, basic needs, and many other stakeholders on campus, and kind of figure out how we can also take some of those existing services and programs and include student caregivers as a population of focus. And then finally, as we maybe have seen throughout today, connection is really important, right? So helping student caregivers connect to resources on campus and in the community, and then also helping student caregivers connect with each other so that they have that sense of social support, can help them feel less alone, can help create a community and provide emotional support and material support throughout our students' caregiving journeys. And so, again, these are just some initial ideas based on some of our findings. And again, moving forward, I'd like to invite everyone to continue thinking about how we can all commit to creating what we call maybe a caregiver-friendly community or a caregiver-friendly university. Okay, so I'd like to just wrap up by highlighting some student voices again. So here's a comment from one of our participants. She says, "I'm not sure if anyone will really read my message, but thank you for thinking about how students are also caregivers during their education. It's something that you don't really see getting the recognition it deserves." So I do want to thank you all for being here and for seeing her message and thinking and recognizing and supporting our student caregivers here at Long Beach. And with that, I'm going to conclude and open it up for any questions. Thank you so much.